Welcome to A Balancing Act. I'm Kelly Burtonshaw. For 20 years, I have worked as a licensed speech-language pathologist and certified dementia care specialist. And I've seen firsthand that when a loved one is diagnosed with memory loss, everyone's lives change. Family members try to juggle their loved ones' now increasing needs for care, while also trying to manage their own lives, families, and careers. It truly becomes a balancing act. I created this podcast with the goal of helping you and your family navigate these challenges head on. Together, we'll find the answers, because no one should walk this journey alone. Let's get started. Welcome back, everyone. I decided to name this episode, Is It Alzheimer's? Because the question I get asked most when I'm talking with people starts something like this. I'm having trouble with my memory. Is it Alzheimer's disease? And my answer is always the same. One brick does not a wall make. While memory loss is one of the symptoms of Alzheimer's, memory problems in and of themselves are not telltale signs of the disease. But that fear of Alzheimer's disease is very real and pervasive. A national survey showed that when asked what health problem they feared most, 40% of the respondents listed cancer as their first worry, and Alzheimer's in a very close second at 38%. And there were a significant number of respondents who stated that they wouldn't want to tell anyone of their Alzheimer's disease. There was a legitimate concern regarding what others might think of them, and that it would change how others would treat them. So today, I want to help replace some of the fear and misunderstanding with facts and steps you can take right now, because whether it's for yourself or your loved one, understanding all you can about the disease now will make all the difference for the future. Okay, let's start with what Alzheimer's disease isn't. As we get older, if we forget a word or a name here or there, where we put our keys or what someone said 5 minutes ago, don't worry about it. It's completely normal. This is known as age-related forgetfulness. It's important to note that I didn't say memory loss because there is a difference. With occasional forgetfulness, you will likely be able to recall some or all of the information at some point. With Alzheimer's, recall doesn't happen. And forgetfulness doesn't interfere with your ability to do everything you do each day. More than anything, it's just annoying and at times embarrassing. Our brain and its chemistry change as we age, and occasional forgetfulness is just a normal byproduct of those changes. Alzheimer's disease causes abnormal and progressive changes within the brain. This is because over time, it causes widespread damage to the brain's circuitry in its ability to try and repair itself. Now, the damage begins in the area of our brain associated with memory, but then it moves to areas associated with language and comprehension, visual and spatial processing, reasoning, and behavior. Damage to these areas that will interfere with the ability to function as you normally do, performing even everyday tasks, becomes a problem. But the only way to find out what is going on is by going through the process of getting a diagnosis. So to help you prepare for what you might learn or hear, I want to clarify some medical terminology to help you walk through the process of diagnosis with a better understanding of what is going on. Dementia is not a disease. It's just an umbrella term for symptoms related to abnormal changes, and this is important, in at least 2 areas of the brain, not just memory. I'm going to repeat that. Dementia is an umbrella term for symptoms related to abnormal changes in at least 2 areas of the brain, not just memory. And there are 2 types of dementia symptoms. First, there's what's known as primary dementia. This is caused by abnormal age-related changes to the brain. For some reason, the brain's aging process develops in atypical ways. Secondary dementia presents as symptoms of abnormal changes directly related to the damage caused by a specific disease or condition. And the reason it's important to know the difference between the two is because not all forms of dementia present and progress in the same way. To simplify this for better understanding, it all has to do with the underlying cause. For example, Alzheimer's disease affects the brain in different ways than vascular disease or Parkinson's disease or frontotemporal dementia. Now, I know this is a lot to process, but I want to give you a big takeaway here. It's what's behind those abnormal changes in the brain that determines dementia. You may not have Alzheimer's, but a different cause behind the problems. More reason to call you or your loved one's doctor to find out what the cause may be. Now that we've talked about what Alzheimer's is and what it does, if you still suspect you or your loved one may be showing symptoms, the next step is to reach out to your or your loved one's doctor. And to prepare for that appointment, it really helps if you can document the things that have been happening to you or your loved one, day-to-day changes that you've noticed. And it also helps to bring a list of questions you want to ask, including how familiar the doctor is with assessing and diagnosing dementia, and any circumstances in which he or she would refer you or your loved one to a specialist. Now, there is no single test that can determine Alzheimer's or other dementia. Doctors and specialists will use your documented experiences, along with medical history, any neurological exams, comprehensive cognitive and functional assessments, brain imaging, biomarker or blood tests, and any other assessments they might need to reach an accurate diagnosis. And don't worry about tracking all this because I've included information about these tests in the show notes. But it is estimated by experts that we can now diagnose Alzheimer's dementia with over 90% accuracy. And if that diagnosis returns as Alzheimer's, the next step is to learn everything you can about where you or your loved one are in the disease process and what's likely to come next. There are so many different ways that people describe the stages of Alzheimer's dementia. But in my experience with families, I find that describing the stages in terms of degree, such as mild, moderate, and then severe, or in timing, such as early, middle, or late stage, are easier to wrap your head around than all the clinical stuff I describe in my patient notes. Across these stages, we know there are some symptoms that are likely to appear. But Alzheimer's doesn't progress in the same way and at the same rate for everyone, and there is often overlap of symptoms between the stages. To reduce confusion about this, I've included resources in today's show notes about each of these stages and their related symptoms. Now I know, information like this can be difficult to hear and process. It's a lot. But I will tell you what I tell my families and patients. I would not be doing my job if I didn't give you as much information as possible to help you on this journey. As we come to the end of this episode, I want to stress again the importance of getting a diagnosis, because the earlier you or your loved one gets that diagnosis, the sooner you will qualify for services from Medicare to help you across the stages of this disease. And once Alzheimer's is confirmed, there are medications that can alleviate some of the symptoms. There might also be clinical trials you or your loved one can participate in that could provide medical benefit. And an earlier diagnosis also allows time to talk with family members about how you or your loved one want to live the rest of your life. This will promote peace of mind for everyone involved. It reduces the possible burden on family members, and it will prevent future quarreling and disagreements. Now, I know this episode was probably a lot to deal with on a subject that so many people dread. But I believe, and I've experienced, that with education and resources on your side, you will be able to face whatever comes your way with better clarity and strength. I never want you or your loved one to feel victim to the disease, but as empowered self-advocates. And if you have any questions, please message me on our Facebook page. I want to give you as many resources and answers as possible. The link is in today's show notes. Finally, wherever you are in the process of this journey, please remind yourself that no one is perfect at this. No one. You're doing the best you can. You're doing it from a place of love. And that is enough. My name is Kelly Burdenshaw, and it was my pleasure spending time with you today. Keep in touch.
I'm Peggy Wright, editor and producer of this podcast. Join Kelly each week as she talks about the issues facing families navigating a loved one's memory loss. If you like this episode, let us know by following A Balancing Act on Facebook and wherever you get your podcasts. We hope you'll take a moment to rate and review today's episode. This will help us continue to create content that is relatable, relevant, and reliable. Questions and comments for Kelly can be posted on our Facebook page. Links are in the show notes. We look forward to hearing from you. Thanks again for joining us today.